You are welcome to today's update. Thank you for coming back. I'm going to start off with the United States this morning. It's the day after, it's the 4th, and we'll be talking about the United Kingdom as well in today's update. Now, I've actually been following events in the United States since I was 12. I started listening to Alistair Cook's Letter from America. It used to be on at 8:45 every Sunday morning, and I listened to it for must have been about 30 years. And to be quite honest, I've never seen the United States more divided since the Vietnam era. And I remember the end of American involvement in Vietnam back in '73. I must have been about 15 or 16. And it is concerning. So I wish you absolutely the best for a smooth transition of power, or indeed a continuation of power. But of course, nothing's going to change till January anyway. Right, down to the business in hand. Let's have a quick look at the overall map of the states first of all. Now this is the number of cases in the last 7 days, and it's concerning to see the more populated states with increased numbers of cases in the past 7 days, but the overall trend is most certainly increasing. Let me just show you this graphic here. Again from CDC. I mean, we can clearly see an increase, can't we? The question is, where is it going to go? I mean, is it going to carry on increasing? And given the way that the United States has responded to this pandemic, which I feel freer to speak now, often it's been completely lamentable, uncoordinated, unscientific. Frankly, sometimes it's just beggared credulity, the way things have happened in the States. Unfortunately, because of those factors, I do see it going up. But we'll be having some words of wisdom from Dr. Birx shortly. Now, in the States, what do we have? 9.3 million cases, 231,000 deaths. I mean, this is a big number. I know per capita and all this kind of thing, but it's still a big number. Last 7 days, cases 25.6 per 100,000 of the population. That's an additional 600,000 cases, near enough, and well over 5,000, nearly 6,000 deaths. Now, in the light of this data, to say the US is rounding a corner, well, let's think about it. Does that look like that's rounding a corner to you? I mean, to say the US is rounding a corner is inconsistent with the data as I perceive the data. It's laughable, isn't it? I mean, if it wasn't so serious, this would be laughable. There's a complete disconnect here with the reality of the situation. So US rounding a corner, I wish it were true, but it's not. It's patently not. Politicisation, political attitude to public health measures has been a bit of a curse, really, through I use that term advisedly. It's been a bit of a curse. You know, all the brilliant people in the United States, all the brilliant doctors, all the brilliant scientists, and yet it's been reduced to this bipartisan political approach, which has no place in public health. We learnt how well Taiwan did a couple of days ago, and there the politicians stepped back. The medical staff took over. Not saying they were always perfect, but it worked for Taiwan. You know, the idea that wearing a mask is a political statement is absurd. You know, there's many things wrong in the UK, but, you know, both political parties wear masks. You know, it's not an issue. It's just ridiculous. And I'm just sorry to see that it's the case. We know that wearing masks is efficacious. We've looked at that many times on this channel. Science denial is not what we need, because science is the study of the nature of reality. So science denial is in fact reality denial. And it's not what we need. We need to marshal every weapon we have against this virus. And in the United States, you have superb intellectual weaponry. I really hope you can find a way to use it. Now, of course, it's often said that increasing cases is just due to increasing testing, so let's give counter-argument to that. This is the hospitalization data that we have here. So this is artifactual. This is because cases aren't yet reported. This is, we see an increase to here and an increase to there. So we see hospitalizations are definitely increasing in the United States. And this is true in all age groups. When we have more data in here, alas, I feel sure that those markers will go up the way. What else have we got here? Here we have COVID symptom tracker data. Now this is test positivity, because another very useful indicator of how much community spread there is the percentage of 100 tests that come back positive. Nationally in the US at the moment it's 7%, that's high. It's about the same as the UK, but of course the UK, well, it's about the same as England and Wales. In the rest of the UK it's not too dissimilar, but of course we're actually going into a lockdown for a month tomorrow, England and Wales. So the positivity rates again indicate, with the overall figures, again agreeing with the hospitalizations directly from the CDC. This is a live feed. And we see the positivity in the more populated states again is high. And then if we go down on this site, it gives us, so I mean the information from the states is just brilliant. Here we see all the different states and their percentage of positive testing. Now this is high. This indicates a lot of community spread. Alabama, Florida, Idaho, Mississippi, Montana, Nebraska, South Carolina, Texas, some populated states there, all with these high levels, and even, you know, another huge chunk of states at the 6 to 10 mark. So to my mind, this is certainly not an artifact of increased testing. We see increased overall numbers, we see increasing positivity, indicating more community spread, and we see, alas, increasing hospitalizations. The trajectory in the states is not good. And we heard Dr. Fauci talking about this just a couple of days ago. Dr. Birx, White House team, of course. It was just painful to watch Dr. Birx have to sit there through some of the presentations that were given for political reasons. And I'm not taking political sides, but, you know, things that were scientifically inaccurate were said, and she had to kind of sit there and listen to this twaddle, dangerous twaddle. Got to feel sorry for the lady, but she looks like a tough cookie, so I'm confident she's going to fight back. So Dr. Fauci was very concerned. Dr. Birx, we are entering the most concerning and most deadly phase of this pandemic. The worst is just about to come, according to Dr. Birx. This is a leaked memo, I believe, from the White House. Now, this is from the New York Times. I will put the link in the description, but it was a bit long, and it wasn't working for me either. But I did get it straight from that this morning, so it is a genuine news report from a reputable source. This is not about lockdowns, so she's not saying lockdowns is necessary. It's not been about lockdowns since March or April. It's about an aggressive, balanced approach that is not being implemented. You know, the simple things that are not being done is what Dr. Birx is railing against. And the irony is that most of these interventions, these and the ventilation and all that kind of stuff, is dirt cheap. It's behaviour, it's belief, it's attitude. Go with what the science says. This is what the science is saying. Believe it. You know, you switch on your TV and it works. You fiddle with the internet and some of the time the internet works. It's all based on physics. It's science. You know, we assume science is working all the time, and yet here we have other aspects of biological and medical science, and a lot of people say, bleh. She warned about the political rallies that have been held lately. These could be, this is not Dr. Birx's words, it's mine, but some of these political rallies, as we saw in Kenya yesterday, could potentially be super spreader events. It's good that they're outside, so hopefully they won't be. The memo goes on to predict days of 100,000 new cases per day, and I think we looked recently, there's getting on for 600,000. 550,000 new cases, I think it was, we looked on yesterday's data in the past week, so it's not far off that level. Then of course there'll be a percentage increase from that, and that'll take it higher, then a percentage increase from that, and we get this upward trajectory. Now, other concerns about the United States. Always disconcerting to see, in England we call them Nightingale hospitals. After the Great Florence, here in America the field hospitals, but it's the same thing, Wisconsin and Texas. So anticipation there. Colleges and universities, many have reopened campuses, not all, but college towns have had higher growth rates. So far, according to CDC data, again just from a few hours ago on the 4th of November, 214 students and 214,000 students and employees, 16,000 institutions affected, 70 deaths, thankfully only I think 2 amongst students. But jails and prisons in the States, again, dear me. Again, New York Times is saying over 250,000 cases. CDC is saying over 200,000 cases in American prisons. These are huge numbers. Cases amongst inmates, 166,728 according to the CDC. Amongst staff, 37,635 according to the CDC. Well over 1,300 inmates have died. This is appalling. It's an appalling situation. Staff, 56 tragically died. Okay, now the CDC have also said, this is a bit of a parenthesis really, but the CDC have also said that yesterday, if you can vote even if you're quarantining, the rules are kind of suspended. So again, the potential for pretty significant spread rather than organise some sort of proxy voting. And of course, postal votes are being greatly argued about. But people that have been told to self-quarantine in the past few days, for example, perhaps they've just become symptomatic, no time to arrange a postal vote. And of course, you are most infectious in the first day or two after symptoms. This is a bad combo. It's not good. These things don't go well together. So they gave some tips. Voters have the right to vote regardless of whether they are sick or in quarantine. So they have the right to vote. And then it gives a few pieces of advice there that people should follow. They're just copied directly from the CDC site. Go and check it out for yourself. Advice to protect yourself using transport, for example. Open the windows if you can. Glad to see the ventilation messages getting through. And all the sort of common sense advice that you would expect. But remarkably important, because Dr. Birx seems to think that this is not always being done. Now, UK government. Let's have a look at some UK government data. Let's start with hospitalizations, I think. Yes, here we are. Yes. These are people currently hospitalised in the UK. And this is why we're having the lockdown, of course. I mean, that was the peak here. Just under 20,000. Now we're over 10,000, so we're getting past the 50% mark for the peak. And that the direction of that line, of course, is a child could recognise that upward trajectory, which is really quite concerning. You see, we've said this many times, it's possible people could need medical care and not get it, therefore die. That's quite possible. This is what we need to curtail everywhere. UK government data, an extra 20,000 cases officially diagnosed, tested cases, high number. According to the COVID symptom tracker app, it's not 20,000, it's 42,000. 610,000 people they estimate currently infected. Deaths went up quite a lot. To be fair, deaths always do go up a bit in the day or two after the weekend, but it's still increasing number. Highest number since the 27th of May, so it's highest number for 5 months in increase in deaths. And certificated deaths from the ONS are 63,000 deaths, not the deaths within 28 days of testing, which is the 47,000 figure. So month lockdown starting in England tomorrow. Stay at home as much as possible. Unless for work or education, caring or seeking healthcare are the usual exceptions. Household mixing is absolutely forbidden. Not indoors or in private gardens unless you're in a support bubble, for example with elderly parents. Pubs, restaurants, non-essential shops closed as you would expect. And the big concern why this is being done is the hospitalisations in the UK are going up and are projected to go to the point worse than the worst case scenario that was estimated just a few weeks ago. Going up to the point where people will be dying through lack of medical care in the United Kingdom, and that is not, for someone who's spent 40 years in healthcare, I just feel, I'm getting emotional just talking about it. Let's move on. So UK, an extra 1,500 patients are admitted, 11,000 actually hospitalised now. So that data there is actually slightly out of date. What's the latest figure there? Yeah, it's slightly out of date, that data. Yeah, that goes up to the 1st of November. In fact, that's the 29th of October. So that's a bit out of date. So the trajectory is higher than this now. So 11,000 patients in hospital at the moment in the UK. Of those, 1,075 are in intensive care units. So in the brackets, it's the intensive care unit numbers. Right, England, another nearly 1,300 patients, taking up to 10,377, 952 in intensive care facilities in the UK. Scotland, 1,225 patients in hospital, 93 in intensive care. Wales, 866 in hospital for a population of only about 3.1 million, I think. 57 in intensive care. Northern Ireland, again, much smaller population, 379, 42 in intensive care. And it's that direction of the line that is the concerning point. Right, so that's, I think that's fairly short today. That's what I'm going to say about the United States and the United Kingdom. Both countries are in for a difficult few months, and we have to realise this. And while we could argue about the expensive measures like lockdown, there's no argument about the simple measures. Let's get the simple stuff right, and that will have a huge effect. Mask wearing 100% in all public places, ventilate, hand washing, social distancing, no family mixing, no parties, no mass spreader events, indoors or outdoors. And sadly, for a period of time, that also means no indoor religious services or outdoor religious services for the time being in the UK as well. This is for a period of time. Now, this is difficult for many, and I probably say this about once a week. If you feel you need help, tell someone. Please. If you see people around you who might need help, come alongside in whatever way you can. And have a high level of awareness for anyone that might be distressed. And remember, the people that are most down or depressed often have the most difficulty expressing that. Okay, we'll leave it there for today. Thank you for watching as always.